I'm going to get started. So again, I'm Debbie Plotnick. I'm Executive Vice President for State and Federal Advocacy at Mental Health America's National Office. And I have the great honor of coordinating our Regional Policy Council, or RPC, as we call it. And I want to begin by thanking our partners that make the RPC events possible. Jackie, do we have that slide? There we go. I want to thank them by name. I want to thank Compass, Johnson & Johnson, Myriad Genetics, Neurocrine Biosciences, Utska, Pfizer, Sage Biogen, Takeda Lundbeck, and Teva. Again, we truly appreciate your support for the Regional Policy Council. Today's webinar is being recorded, and you'll receive a link to the recording next week. It'll be there, and then you are welcome to listen to it again or have other folks in your office listen to it. So we know there's going to be a lot of questions and a lot of good information shared today. And many of the questions you may have about the post-election landscape probably will be answered by our presenters as we go along. But please feel free to put questions in the chat. And many of them will be answered at the end if we have a few minutes. And if we can't get to them, we'll be happy to reach back out to you with answers if we haven't been able to cover it. Today, we're going to be hearing from several members of the Alpine Group and members of our Mental Health America National Policy Team. We're going to start with folks from Alpine, and the Alpine Group is a bipartisan, bicameral government affairs consulting firm, and they're located in Washington on Capitol Hill, and we work closely with them at Mental Health America at our national office. So we're going to hear from Shane Woods, and he's vice president of the Alpine Group. And Shane has worked in both the U.S. House and Senate, focusing on issue areas including healthcare, budget, commerce, science, and transportation. His close work with the Senate Finance, Health, Education, Labor, and Pensions, that we all know as the HELP Committee, has resulted in securing numerous extensions for healthcare provisions. We're also going to hear from Courtney Johnson, and she's a principal at the Alpine Group. And Courtney leads the healthcare practice there, and she's been recognized as a top lobbyist by the Hill and has executed numerous advocacy campaigns on major health legislation. Courtney is a leading figure in shaping policies related to healthcare. So I'm going to turn things over now to Shane and to Courtney.
Well, thank you so much, Debbie, for that kind introduction. Again, thank you all so much for having us. Shane Woods, Vice President with the Alpine Group, working, as Debbie mentioned, with the healthcare team, with the healthcare practice here at the Alpine Group with my colleague, Courtney Johnson, who leads our healthcare practice. And so with that, I guess we'll go ahead and jump on into today's presentation. So on our first slide here, wanted to just start with a brief overview of the election from this past, not this past Tuesday, but last Tuesday. As you can see there from our key takeaways, where things currently stand from our graphic, the House currently stands at 208 for our Democratic colleagues and 218 for our Republican colleagues in the House. The Senate currently stands with a 53 to 47 margin in favor of Republicans. Of course, there is a recount currently underway in the important key swing state of Pennsylvania between David McCormick and Bob Casey. So we'll, of course, await to see the ruling there, but that one is expected at this time to remain in Republican hands. But of course, nothing is finished until all the votes are counted or recounted in this case. And the White House is now swung to control to the Republicans, in particular, President-elect Donald Trump. So this is actually the first trifecta since 2017 for Republicans. Many of you recall the 2016 election. Republicans once again control all of the various levers in Washington. And so with unified Republican government, just like with any unified party government, there's going to be some opportunities for what we call budget reconciliation, which is essentially a procedural process that allows for the governing party, in this case Republicans, to pass legislation using simple majorities and be able to avoid, in particular, the Senate, a 60 vote threshold, assuming, of course, that nothing is that everything conforms to the rules governing the reconciliation process. But we'll get more into that later in our presentation. The election actually had some key features. We did see a much higher rural turnout. In addition, we also observed some ticket splitting. We don't see that often, but we did here, in particular in those 7 key swing states. We did see 5. We observed ticket splitting in 5 of the 7 swing states. Arizona's Senate race, we did see folks at the top of the ticket vote for President-elect Donald Trump. While below that, in the Senate race, we did see folks vote for Ruben Gallego. And in Michigan, the same holds true there for Trump and Slotkin. In the North Carolina governor's race, we did see folks vote for Trump and then Josh Stein. And in Nevada, Trump and Rosen. And Wisconsin, Trump and Baldwin. And so another key feature that we observed as well in this election, according to the New York Times, 54 counties did flip in this election cycle from blue to red. Next slide, please.
So as we head, so Congress actually returned this week post-election. We're doing several different things. We're having a subset of leadership elections. We'll have both House and Senate Republicans had their leadership elections yesterday, which we'll talk a little bit about later in the deck. House Democrats are slated for their leadership elections the 19th. Senate Democrats are likely doing theirs after we get back from the break, the Thanksgiving break. But we have 2 weeks of session here. We also have new member orientation, which is a 2-week-long program where new members are kind of introduced to the how to manage and work within their new roles as either senators and or members of the House. But what a lot of people want to know is, what are we going to do in the lame duck session? And so that's what we're going to talk about for the next couple of different slides. Well, we're not anticipating a huge amount of legislative activity in November, even though they will be here next week. We have basically 3 primary vehicles that Congress has to think through what they might or might not do at the end of the year. We're going to start off with the CR, as I think everybody on this call likely knows. We are operating on a continuing resolution funding the government through December 20th. There's kind of 3 options on the table of what we can do in terms of funding the government for fiscal year 2025. Right now, there's a huge delta in spending between the House and Senate bills. That's $130 billion, and that's a big impediment to moving forward. So we have option maybe number 1, and probably the most likely, is that we do a CR that's going to take us through a continuing resolution that will take us through March of 2025. Another idea that's been floated is a continuing resolution that will take us through September of 2025. Or, and this is I think the least likely, we could actually come to a spending agreement, get top line numbers, and actually complete our work on fiscal year 2025 this December, which doesn't seem very likely right now because of that huge delta. between the two, and the fact that Congress really would need to have those top line numbers in advance of the Thanksgiving break to actually get their work done by December 20th. So I think we're looking at the CR package and how we can probably switch slides. I think one thing to kind of flag in the context of these lame duck negotiations on the CR is there's a very large open question as to how they're going to treat earmarks and what will happen to the earmarks associated with the fiscal year 25 budget process. In the Senate, you only have maybe a third of Republican senators that actually participate in the earmark process, but they split the earmark dollars evenly in half. So those 15 senators actually benefit well. So you'll have like 47 Democrats that have to split whatever the number is, and 15 Republicans. So it's an open question of how earmarks will be addressed in the CR process. The other thing I would just flag is it's actually not clear yet to the Schumer team and who they're negotiating with in terms of this end of the year package. Is it going to be McConnell's team, or is it going to be incoming Majority Leader Thune's team? So that also should give you an update on where they are in their negotiations. They haven't started because they don't know who their negotiating partner is. So I would just flag those things. Two other bills out there that we need to contend with before we leave for the year. We have the National Defense Authorization Act. This is an annual process that we do in Congress. It tends to be a closeout vehicle, or has been in years past. Right now, staff is working very diligently to close out the NDA process to have it ready for the Senate floor when we get back from that Thanksgiving break. We also have the disaster supplemental deal with both Hurricanes Helene and Milton. The White House has been sending up supplemental requests. They have not touched FEMA yet. There was a Twitter universe kind of conservative issue saying that the dollars weren't going where they were supposed to be going, but we are anticipating Biden will set up a fulsome supplemental request imminently, and that Congress will deal with that. It's possible that actually the disaster supplemental could be a vehicle for the CR, because there are times there's certain Republican members in the House that don't like to vote for CRs, and so if you pair them together, that might make it a more attractive option. But these three vehicles are where what we end up doing on healthcare would ride, and that's why I'm flagging them all. So those are the three options for whatever healthcare policies Congress is actually able to dispense with this year. With that, I think I turn it back to you, Shane, to talk a little bit about our lame duck legislative candidates.
Yes, appreciate that. So, drilling down a little bit further, in zooming in specifically on the healthcare side of things. So this year has really just been marked by a lot of kicking of the can, if you will, to use the old DC turn of phrase, which has effectively left us with a regular recycling center at the end of the calendar year here that we have to contend with. A lot of legislation that moved through what is often referred to as regular order. So that is legislation that moves through a committee consideration process, then moves to the actual chamber floor to then be voted on either the House or the Senate, and then move to the other chamber, just depending upon where that piece of legislation originated. If that's a Senate piece of legislation, moving then over to the House. If a House piece of legislation, moving over to the Senate. So we have a lot of pieces of legislation in the healthcare space that have gotten caught up in the process. And so now the question then becomes, at the end of the year, considering now we find ourselves, as Courtney just mentioned, that we aren't necessarily looking at highly likely a massive spending package that will carry a lot of priorities of various members, likely a continuing resolution, as she mentioned, a short-term continuing resolution, which would allow the incoming administration to exercise or be able to put their mark on congressional spending, and allow the newly flipped Senate to exercise, their leverage over some of these spending top lines. Now it becomes a matter of, what could actually ride on that continuing resolution. And so, with looking at this, of course, the big question in Washington has always been, okay, you have a lot of legislation that you want to pass, but how do you pay for it? And so the size of, as we mentioned here on the slide, the size and the scope of a potential, healthcare package is going to largely depend on Congress's ability to offset that legislation or those pieces of legislation. And so we've outlined here a few candidates that could be included, that could be seen in an end of year healthcare package or healthcare section of a spending package. One of the things that seems to have broad consensus is Medicare, various Medicare and Medicaid extenders. These were also included, some of these extenders were included previously in the September continuing resolution that is expected to expire in December. And so again, this is likely to be a candidate for consideration at the end of the year. Additionally, Support Act or provisions thereof. There is again this bipartisan desire to extend this critical mental health and substance use program legislation. Chambers, the House chamber and Senate chamber have done work on this particular piece of legislation. And so this could potentially be something that is carried at the end of the year, as well as numerous public health reauthorizations. Of course, the Committee of Jurisdiction in the House for Public Health is the House Energy and Commerce Committee. And they've reported out really just a spate of various public health bills, everything from community health centers, to things like the Dr. Lorena Brin, Healthcare Provider Protection Reauthorization Act, as well as other items as well that could be included or reflected here at the end of the year. Some additional candidates for consideration for an end-of-year package does include the physician pay fix. Congress routinely runs up against various doc cuts or payment cuts, and usually extends some aid in one form or fashion. Now, how long that aid is or how much aid is provided, again, really depends upon what the budgetary headroom for something like this looks like, and Congress's general feelings on how big they want to go or how small they want to go. So that'll certainly be something that'll impact that potential fix. Pandemic preparedness, of course. This one unfortunately has been stymied over some disagreements over the things like the inclusion of drug shortage policies, some CDC related policies, and of course those pesky price tags, right? The overall funding levels. So we'll see what happens there. It's likely to have some form of extension there, likely a short-term extension, 1 or 2 years. But again, that's largely going to depend on the budgetary headroom and the appetite of members. The Biosecure Act, this one is having to deal with countries of concerns, foreign adversaries stealing sensitive American genetic data, personal health information, all kinds of various terrible things. But again, this is one of those that we would expect to see likely go on the National Defense Authorization Act or the reauthorization of the National Defense Authorization Act, and could be included with some other China-related legislation. But again, that prospect is still up in the air at this point. And then, of course, a big one on folks' radars, PBM reform, the middlemen, right? Congress, of course, in both chambers have worked on legislation to rein in some of the more nefarious practices of, the drug middlemen and would try to provide greater transparency, in particular, into PBM operations, and try to de-link PBM compensation from drug prices in an effort to really get arms around the skyrocketing drug price issue. Of course, this could also lead to some savings here as well, which could very well help with offsetting the price tag for this particular section of the package for the end of year consideration. And so this is one of those that many members are trying to beat the drum on to see go. We've also seen various advocacy groups as well sign letters of support to Congress saying not to forget about this important work and their desire to see this move at the end of the year as well. Also, kind of in the same vein as PBM reform, price transparency. Both chambers have attempted throughout the Congress to pass legislation to increase price transparency for consumers. But this one has been hung up on some policy disagreements, in particular around site-neutral payments. There was a recent proposal from Senators Cassidy and Hassan introduced around site neutrality. As far as whether or not that would be ready for game time, it doesn't quite seem like it's there yet, especially as we're in the now waning days of the 118th Congress. But certainly an important policy to keep in mind and to keep on the radar. Drug shortages, of course, this is another one that's gotten a lot of play this Congress, addressing some of those pesky drug shortages that we've seen throughout the system. This one could also potentially see a policy or two, that address drug shortages here at the end of the Congress. And lastly, Medicare modernization. And again, both chambers, have held hearings and markups on this. In particular, Energy and Commerce has held hearings and markups, that have included various members' priorities, on how to improve and even modernize the Medicare program. Of course, committee has been very insistent on its desire to utilize regular order. And so at this point, they've only taken action in the House on legislation that has received what's referred to as a CBO, or a Congressional Budget Office score. CBO, for those of you who may not be familiar, think of them as a big calculator. They're the official scorekeeper in Congress of legislation that committees of jurisdiction are considering and are moving. And generally speaking, folks like to know the price tags of things before they move them. That's not always the case, but is certainly often the case. You'll have either a full Congressional Budget Office score, or to the best of their ability, a congressional budget estimate of what the cost of legislation may be, just depending upon the size. Sometimes it can get pretty hairy trying to turn around scores for massive bills, but they do their best, and they do really good work. As well as the House Energy and Commerce Committee, House Ways and Means has also done some work in this area as well. So I'll go ahead and turn it back over to my colleagues, Courtney.
I think that's kind of what we're looking at as we close out the year. And on it, obviously, next year is going to be influenced by what Congress is or is not able to do on those packages. So work streams that don't see action this year, but at the end of the year, like in terms of becoming law, likely are still ripe. I'll pick on drug shortages only because I had conversations today with both Republican and Democratic staff, and while that is an area where there's a lot of interest in moving forward and trying to come up with some solutions, I don't think anyone thinks that they're ready to that type of package will hitch a ride on the end of the year. So everybody is saying, you preparing for next year. We still think this is going to be an area of interest with Republican control. So that what isn't done kind of just goes to the right and becomes a part of our 2025 healthcare agenda. For next year. I think Shane touched on this at the beginning. We're also anticipating that the Republicans have stated that they're going to do the reconciliation process, which basically is it allows the Senate to pass a bill with only 51 votes. There's a lot of rules associated about what can be put into a package, but for simplification and just this conversation, basically it needs to actually have a revenue impact. So either it raises money or it reduces money. And if it doesn't do that, it can't go in. So when you think about that, that's Medicare, Medicaid policies generally qualify because generally when you make changes and tweaks to Medicaid and Medicare, they have some sort of revenue impact associated with them. This also likely would be the vehicle for the massive tax bill that Congress has to contemplate next year, and probably a vehicle for something like the ACA premium taxes should Republicans want to depending on how Republicans want to address that issue. So what they've been doing all fall is they asked the committees of jurisdiction to send up ideas at the end of the summer to leadership about things that they might want to see in a reconciliation process. I also should say that these are generally partisan processes, so the Democrats won't be particularly involved in it. And now they're hosting a subset of listening sessions with their members to try to understand what member priorities are out there in terms of a reconciliation package. Their whole goal here is to try to be able to move expeditiously in the first 100 days. So this is the thing. Reconciliation actually always takes longer than we anticipate. So certainly they'll get started, but we don't really expect them to be done until later in the year. I also just want to flag that if we do a CR into next year, that actually provides House Republicans with 3 reconciliation packages over the next 2 years, because they can use fiscal year 2025, fiscal year 2026, fiscal year 2027. So just saying that they have the opportunity to do up to 3 bills. That's also going to be really hard to do in a 2-year time span, but they could certainly try to do 2. I think another thing out there, we have a couple expiring bills. We have the ACA premium taxes. We have an FDA bill with OTC monographed. Senate Health, Education, and Pension Republicans have been working really hard on white papers, trying to tee up conversations for next year. We're anticipating that they'll be releasing one related to the FDA and really touching on all elements and regulated products within the FDA at the back end of this year, along with the CDC. These have been informed by stakeholder conversations, but are also going to be open for additional feedback. So we expect an opportunity to provide input on them. And then I think as Shane referenced in his earlier slide, because all these healthcare extenders and Medicare and Medicaid cost money, it doesn't feel like we have enough money to extend them beyond a year. We are going to kind of create we're going to create another deadline basically at the back end of next year, where we're going to have to re-extend to some degree all the bills that we only did for 1 year. So that could include PAPA, that could include elements of support. That definitely is probably going to include like telehealth flexibilities and things along that line. So that's kind of big picture what we're thinking and looking at for next year. And I think now I'm going to turn to Shane to kind of drill down on what we might see in a House reconciliation package. It will start in the House. Oh, Trump.
Thanks, Courtney.
Trump first, then that. Sorry.
Yep. Before we jump over to the House chamber, let's start over in the White House. Let's start at 1600 Pennsylvania Avenue. So just to give kind of a quick Trump overview of the incoming Trump administration, their healthcare agenda. From a high level perspective, The incoming Trump administration really wants to emphasize access to trusted doctors, appropriate care, with a shift towards direct primary care models that would reduce costs and promote preventative care. There would also be, of course, an effort to protect seniors and people with pre-existing conditions. Some folks that have been routinely discussed around the water coolers of Washington, D.C. with regard to some of the key players to implementing this agenda include former Louisiana governor and now one of the one of the key players at the America First Policy Institute, a think tank aligned with the former president in Washington, D.C., Bobby Jindal. Certainly a blast from the past, maybe a name folks haven't heard in a while, but his name is floating around for potentially being tapped for HHS secretary. Additionally, a name that is getting a lot of making a lot of waves out there right now, Robert F. Kennedy Jr., someone that who's a formerly was in the race as an independent presidential candidate, and is now aligned with the president-elect. Another a person who was actually with the president-elect during his first term. He worked in the administration. Brian Blaze. He's now the head of a think tank, a healthcare-focused think tank in Washington by the name of Paragon Institute. And a colleague of his from the administration as well, who is also at Paragon, Joe Grogan. Some other names that we've heard, as well, Joe Lapido, who is the Florida Surgeon General, and then also we've also heard Dr. Ben Carson as well as a potential candidate for HHS secretary. So diving into some of the key proposals that we could see here, as I mentioned, a promotion of direct primary care models in order to reduce healthcare costs and provide access, some other access points, implementing site-neutral payment policies, as I alluded to earlier. The Cassidy-Hassan framework could potentially be a starting point for members of Congress if they decide to go that route. Removing various barriers to competition, such as unnecessary licensing requirements, in order to maximize the supply of clinicians. Of course, the nation continues to face a doc shortage as well. Expanding access to telehealth services, and also interstate medical licensing compacts to increase access to care, as well as increasing transparency in healthcare pricing and promoting additional healthcare coverage options, including a return to things like association health plans and what is colloquially referred to as junk plans, short-term limited duration plans, as well as expanding access to primary care and support, and supporting seniors with policies that would allow them to remain in their homes. So things like, hospital at home, etc. And looking at ways to, protect Medicare, from, financial strain, in various proposals to do just that. Now, given that we have a unified GOP Congress, the administration has mentioned, I think most famously on that debate stage with Vice President Kamala Harris, concepts of a plan to either replace or update the ACA. Of course, that comes with a caveat, a major one at that, as attempts to repeal and replace ACA would take up, to say a lot of time would be generous. I think it would be an inordinate amount of time, and certainly be met with stiff opposition from Democrats in both the House and the Senate, as well as some moderate Republicans as well. And of course, outside advocacy groups. Modifications of ACA, though, that could occur. And so, what would those modifications look like? Well, there could be attempts to, modify ACA's framework, again, by expanding use of these associated health plans or other insurance products. Things like, even allowing for the purchase of health insurance across state lines, an expansion of health savings accounts, a real focus on fraud, waste, and abuse, including, some additional verification requirements for signups. That could have, unfortunately, the unintended consequence of, making it harder for people who need coverage, who are eligible for coverage, to actually obtain coverage. And so, there is certainly a delicate balance that an incoming Trump administration would have to consider. Looking at another thing that could have the unintended consequence of actually lowering coverage for those who are eligible, defunding of ACA marketing and outreach. That was something that we saw during the first term of the Trump presidency. We could see that yet again. A limit, as my colleague mentioned earlier, a limit or even a full-on repeal of the ACA's enhanced premium subsidies, which of course, again, could have the unintended consequence of causing a spike in the uninsured population. Medicaid expansion rollbacks, including some potential changes to things like eligibility or renewal policies, things like potential for work requirements for able-bodied, working age adults, ending the FMAP expansion, per capita caps, block granting, things of that nature. So certainly would want to stay frosty on that. Some potential rollback of essential health benefits as well, which of course, could impact access to maternal and mental health services. And even declining to defend ACA challenges by states, or even join those challenges in certain cases to the law. I do have a bit of breaking news. It appears that the president-elect is set to name RFK Jr. as the HHS secretary. So breaking news here on today's webinar. All right. Last point I will bring up is that this came out on the campaign trail that the VP-elect Senator J.D. Vance had said that the incoming Trump administration, or a Trump administration rather, would provide drug pricing transparency as well as ensure that folks with pre-existing conditions, pre-X, continue to have coverage. All right. Next slide.
I want to just make one point here. I think something that we should be looking out for is, does Mr. Trump end up appointing any czars on specific topics. And I say that because a czar is something you don't have to confirm and generally sits in the White House, and proximity matters. So they would be that. So if they have healthcare specific czars, they've done like a border czar, for example, already. That person would be sitting close to the president and have his ear on a regular basis. So just something for us to watch for. Oftentimes those roles are given to people that they also think would struggle with the confirmation process.
Great point. Thanks, CJ. That's a good flag. All right. Jumping over to the House. So the House Republican Budget Committee and the Republican Study Committee, which represents approximately 80% of Republicans, they had released earlier this year their fiscal year 2025 budgets. And we think that that could actually, be considered a fairly good roadmap for healthcare related policies that Republicans, could include in a reconciliation package. In particular, Republicans may be looking at healthcare as a piggy bank, and we'll kind of jump into why I characterize it as that. For instance, there could be some proposals included in there to, again, cut the premium, the enhanced premium tax credits, right? The premium assistance. There could also be some Medicaid rollbacks as well. Ending the expansion of Medicaid. Things like, again, going back to those per capita caps, even potentially block granting as well, and also some CHIP funding as well over the next 10 years, over a 10-year budget window. There could also be, of course, as I mentioned earlier, some work requirements added to Medicaid as well. There could also, be an allowance for Medicare to cover FDA approved, phone applications, to treat things like depression and PTSD. There could be a repeal of the, what's known as the Housing First policy, which really requires entities, that receive federal housing to focus on putting those beneficiaries into permanent housing before addressing, other issues, things like substance use disorders and the like, right? One of those social determinants of health, if you will, Maslow's hierarchy of needs, making sure that we're addressing, the key thing of making sure folks are housed, and then, treating those other issues as well. Ending, of course, the Medicare drug price negotiation program, and then reforming the 340B program as well. As far as reconciliation is concerned, they are looking at taking a page out of the Democrats' book and really doing a whole of government approach. In fact, the incoming Senate leader, John Thune, previously said, and I quote, there will be a focus on energy, there will be a focus on the border, there will obviously be a focus on extending the current tax policy known as TCJA, or the Tax Cuts and Jobs Act. That we have in there. There are, some things I think you can do on government spending and bureaucracy, end quote. But again, as Courtney mentioned before, there are rules that govern this process. And so it'll be a lot of this will, maybe have to be adjudicated through the Senate parliamentarian to determine, what is germane, what is not germane, and, what may violate the rules associated with reconciliation and thus would trigger a 60 vote threshold in the United States Senate instead of just going via a simple majority. Also, important to note that changes to things like Social Security and non-germane content, as I mentioned before, again, could trigger that 60 vote threshold. As well, we are already seeing conversations that are occurring between the Senate and the House now that the House has officially remains with Republicans. There were earlier conversations that were just occurring on the House side, but now they are including the Senate. And the House Budget Committee Chairman, Jody Arrington, is actually looking at, the mandatory health spending, again, as I alluded to, as an area to find savings when working on the reconciliation package. He's quoted as saying, we've got to look at the spending side. It's really tough to get to the mandatory programs without reconciliation. He goes on to say, we want to take the opportunity for every package that exists, and there are 2 opportunities in that calendar year next year, although Courtney did mention that, with a continuing resolution passed at the end of this year, that could move from 2 opportunities to actually 3 opportunities. Again, we'll certainly have to see what happens there. And of course, the bigger the package, the more issues you tend to run into, and the longer the timeline goes. And the clock is certainly ticking for Republicans, who are going to be facing an uphill battle, to say the least, as they head into 2026 with a map that is not so favorable. They're going to be defending a lot more territory than going on offense like they did here in 2024.
Shane, that was really informative and scary. And I'm not seeing questions because I think you and Courtney have answered so many of them. We're going to take a few minutes now and transition to hearing from Karen Howard, MHA's Director of Policy and Advocacy, and Tim Clement, who is our VP for Federal Government Affairs, and they're going to tell us about some of the bills that we hope to see as the year comes to an end. So I'm going to turn it quickly over to them, but boy, that was comprehensive, and we truly appreciate it.
Thanks so much, Shane and Debbie. So I'm Karen Howard, Senior Director of Policy and Advocacy at MHA, for those who I haven't met yet. Obviously, Tim here, my colleague, and we'll talk a little bit about our priority bills and then some of the talking points or messaging changes that will be more effective in discussing our issues with key leaders. And then we can talk about key states and ways that you can continue or begin your engagement with our federal and state advocacy work. So MHA's policy of ensuring our bills are bipartisan will continue to come in very handy for the viability of our priorities. There's a little bit more predictability now that we know the House will stay Republican controlled. So we think that most of the chairman positions will stay the same. And that's helpful since we have some bills that are already taking some action. I'll talk a little bit about the Peers and Medicare Act, and then Tim will cover the Real Providers and Early Minds Acts. The Peers and Medicare Act is legislation that would expand Medicare coverage of peer services into community health centers, rural health clinics, FQHCs, and CCBHCs, and it builds on top of policy passed in FY23's Omnibus, which for the first time clarified that peer specialists could provide services in primary care. In this new kind of iteration of the bill, we think that the new codes that were created by Medicare, the Principal Illness Navigation Peer Support Code, would be able to be used in these kind of clinical settings. And we've been working with Ways and Means Committee leadership and are hopeful that the committee might be able to take action in the early part of next year on that bill. So that's good. I'll turn it over to Tim.
Yeah, thanks, Karen. Absolutely, and thanks to the Alpine Group. We just started working with the Alpine Group earlier this year, and they've been really tremendous in helping us have a presence on the Hill and giving us all the latest info we need, like the breaking news you just got about RFK Jr. So the first bill I'll talk about is the Early Minds Act, and that's a very simple bill that would, as you know, there's the mental health block grant. And one thing the mental health block grant can't do is you can't use that funding for prevention and early intervention activities. Early Minds Act would allow states to use up to 5% of that funding for prevention and early intervention. We've gotten great reception on the Hill, and we've got that bill introduced earlier this year on the House side. Bipartisan basis, Congressman August Pfluger, Republican of Texas, is the lead sponsor. And then on the Senate side, we haven't gotten a bill introduced yet, primarily because we had some trouble with some offices getting introduced, but we are going to get introduced, we believe, early in the next Congress, also on a bipartisan basis on the Senate side. So we're very hopeful for that. Every meeting I've ever had with Courtney and Shane on the Hill about Early Minds has been greeted with great enthusiasm. Everyone likes it. Everyone likes the bill, likes the idea. Second bill, real health providers. That's the one bill. There still might be a chance for that to get put onto a package, depending on the scope of the package, depending on what happens. So I'm saying there's a chance. I'm saying there's a chance for that bill to potentially make it onto something. Maybe not, though. And that bill, what that bill is, it's about Medicare Advantage. And I think all of you are familiar with the ghost networks that are prevalent within all insurance types, but Medicare Advantage in particular. And so this would try to increase the transparency and accountability for Medicare Advantage plans, require them to update their provider directories regularly, and have CMS come up with an accuracy score. So that's something that, again, bipartisan, bicameral, it's passed through a key committee in the Senate Finance Committee last year, got introduced in the House this side. So that's something that, if it does not make it into a package this year, we're hoping for very early introduction next year and getting to work on that. And again, the fact, as Karen noted, our bills they're bipartisan. So the makeup of Congress matters a little bit, but I think we're still all full steam ahead.
So just a note on messaging. There are some key terms that we know we won't be able to use as much in the newer Congress. What works? We'll start with what works and then try to cover a couple that don't work. We know that substance use is going to be really important to the administration and the new Senate majority. So as much as we can talk about mental health co-occurring with substance use disorders, which we know happens about 2/3 of the time, that will be a way to ensure that we're making sure to keep mental health as part of the conversation. And then also noting that social isolation and social exclusion typically precedes psychosis or substance use. So talking about loneliness and the importance of belonging and coming together and connectingness is really important for both adult and youth populations.
Yeah, and another thing, as I just mentioned, prevention and early intervention, that is something that everyone in both parties, they agree that's important upstream. I think maybe we might have been familiar in years past where people looked at mental health prevention as sort of something that wasn't real, but that's not the case anymore. People believe us when we talk about it, and we have some good resources to show them that it is real. So prevention and early intervention messaging, that has been working well, and we think it's going to continue to work well. We're greatly positioned as an organization because that's one of our top focuses. So that messaging goes over very well in offices of both parties, particularly Republican offices, and also integrated care, integrating behavioral mental health care into the primary care setting, or the other way around, however you do it, when you integrate mental health into physical health care, that's something that everyone agrees is a great idea. I think there's some bills out there that have a chance to pass for folks on integrated care, but we think talking about integrated care, that's something that's still going to be very popular on a bipartisan basis.
And then just the last one for what works. We know workforce development will be key as part of economic opportunity and growth. And so talking about peer specialists as part of the behavioral health workforce or some of our other really key workforce sectors, that will be a win for us. For what doesn't work, Debbie, I don't know, help us with time. We know there are some things to stay away from.
About a couple minutes, so go ahead for one more, please.
Okay, so we know some of the words that we'll use instead of DEI are high-risk populations, those with disparate impact or who are marginalized or minoritized. SAMHSA's 988 study showed that there were high-risk populations, 9 groups, I believe, and racial ethnic groups were one of those. So that's one way to talk about that. One more. Oh, go ahead, Tim.
Debbie, do you want us to wrap up or do we could one more?
One more, go ahead.
Yeah, one more that I think we've all seen in the reporting to the election, LGBTQ plus, especially the EQ plus component has been very divisive politically and has been used as a cudgel by Republicans. I think we all are familiar with the attack ad. You know, Kamala Harris is for they, them. President Trump is for you. Whether whether that really did have that much of an impact on the electorate or not, that is the belief. And so that is something that messaging about LGBTQ plus it's in a precarious place. That does not mean not to fight for and support it. It just means that talking about it has to be done in a nuanced way. Also, there's a Supreme Court case that's going to have oral arguments on December 4th, United States v. Skrmetti. It's about a Tennessee bill that banned gender-affirming care, puberty blockers, and so forth has been challenged. And so that the outcome of that will have a huge impact on what we see in the states going forward. Are we going to continue to see the all-out assault on LGBTQ plus in certain state legislatures, or are we going to see potentially a halt to that? But that is definitely something that folks are on their heels on that one.
Thank you, Tim. Thank you, Karen. I want to assure everybody that even if we change the way we message, we are not changing our values. So the things that we stand for, we will always stand for. And I want to take just 1 minute as we close out to invite you all, if you haven't already registered for our next Regional Policy Council event, which will be in person in New Orleans on December the 4th. It will be in conjunction with the Council of State Governments. An annual summit will be co-locating in the same place. So we hope to see you there, and we'll be honoring some state champions as we always do. And I once again would really like to thank our Regional Policy Council sponsors. Without them, we wouldn't be able to bring you these really important things. So I want to again thank Shane and Courtney from the Alpine Group for sharing their wisdom, their insights, and breaking news with us. And of course, members of our policy team, Tim and Karen. So again, thank you all for joining us, and this webinar will be recorded. So again, thank you for joining us, and bye-bye.